Ever wondered why subclavian central lines hold such a critical position in medical procedures? Well, they're more than just a conduit for delivering life-saving elixirs into patients' bodies. These lines are the unsung heroes of the medical world, serving multiple key roles. They are used for administering a whole range of substances including medication, fluids, and blood products. Ever heard of parenteral nutrition? That's right. Subclavian central lines also play a pivotal role in delivering this form of nourishment, bypassing the digestive system entirely to deliver nutrients directly into the bloodstream. But their role doesn't stop there. They're also used for monitoring central venous pressure, providing real-time data on a patient's cardiovascular health. It's fair to say that these lines are more than just a medical tool, they're a lifeline for many patients. Understanding the significance of subclavian central lines is the first step to mastering the procedure. The right equipment and choosing the correct side are key in the subclavian central line procedure. Let's start with the necessary equipment. You'll need a central line kit, which includes a guide wire, dilator, and catheter. You'll also need a sterile gown, gloves, and drapes, along with a local anesthetic, antiseptic solution, and sutures. Now let's talk about side selection. This is not a random choice. The patient's condition and the physician's preference both play a crucial role in this decision. For instance, if the patient has a known history of lung disease or chest trauma on one side, it may be more appropriate to choose the other side for the procedure. It's also important to consider the physician's comfort and expertise. Remember, the ultimate goal is to ensure the safety and comfort of the patient. So, choosing the right equipment and side can make a significant difference in the success of the procedure. Correct patient positioning and understanding the indications are crucial to the procedure. Let's dive into the details about patient positioning for subclavian central line placement. The patient should ideally be in the Trendelenburg position. This is where the body is laid flat on the back, with the feet higher than the head, by about 15 to 30 degrees. This position increases the size of the target vein and reduces the risk of air embolism, a potentially dangerous complication. Now, moving on to the positioning of the operator. You would want to stand at the head of the bed or on the patient's right side if you're inserting the line on the right subclavian vein, and vice versa for the left side. Alright, so we've discussed positioning, but what about the indications for placing a subclavian central line? Why would we choose this over other forms of venous access? Subclavian central lines are typically indicated for several reasons. First, they can be used for the delivery of medications or fluids that cannot be taken by mouth or are too irritating to peripheral veins. This includes chemotherapeutic drugs, antibiotics, or hypertonic solutions. Secondly, they are indicated for measuring central venous pressure, a key parameter in managing patients with shock or heart failure. Additionally, they are used for hemodialysis, plasmapheresis, and for providing long-term intravenous access in patients who require it, such as those with chronic illnesses or those undergoing long-term therapy. Another important indication is when other sites for central venous access are not available or contraindicated. This might be due to trauma, infection, or coagulopathy. Finally, subclavian lines are preferred due to their lower infection rates and patient comfort, as they interfere less with patient mobility and care. So as you can see, understanding when to use a subclavian central line and how to position the patient properly can significantly impact the success of the procedure. Knowing when to use a subclavian central line and how to position the patient is crucial to ensure the procedure's success. Despite their benefits, subclavian central lines are not without risks. This is a crucial point to remember, whether you're a seasoned healthcare professional or someone new to the field. Subclavian central lines, like any medical procedure, come with potential challenges. One of the most common is pneumothorax, or the presence of air in the pleural space. This can occur if the needle inadvertently punctures the pleura, causing air to rush in and potentially collapse the lung. Another risk is arterial puncture. The subclavian artery runs parallel to the vein, and a misplaced needle can hit the artery instead of the vein, leading to complications such as hemorrhage or stroke. There's also the risk of infection. Anytime a foreign object is introduced into the body, there's a chance for bacteria to enter as well. This can lead to localized infections at the insertion site or systemic infections like sepsis. Blood clots, or thrombosis, are another concern. The presence of a central line can disrupt blood flow and cause clots to form. If these clots break loose, they can travel to the lungs, causing a potentially life-threatening pulmonary embolism. Lastly, we cannot overlook the danger of malposition. The central line is intended to rest in the superior vena cava, near the heart. But if it's inserted too far, it can cause arrhythmias or damage the heart tissue. Understanding these risks is not meant to discourage the use of subclavian central lines, but rather to emphasize the need for meticulous technique and vigilant patient monitoring. Each risk we've discussed can be mitigated with proper training, careful insertion, and diligent aftercare. Remember, in healthcare, knowledge is power. The more we understand about the potential complications of the procedures we perform, the better equipped we are to prevent them. This is not just about improving our skills as healthcare professionals, it's about safeguarding the lives of the patients we serve. Being aware of the risks helps in taking necessary precautions and ensuring patient safety. Because in the end, that's what it's all about, ensuring the safety and well-being of our patients. Now, let's delve into the process of subclavian central line placement without ultrasound. The first step in this procedure is identifying the landmarks. Start by palpating the clavicle and the first rib, then locate the subclavian groove. It's this groove where we'll insert the needle. Remember, getting your landmarks right is crucial to a successful procedure. Once the landmarks are identified, we move on to the second step, preparing the patient. This involves cleaning the area with an antiseptic solution and draping it in a sterile fashion. It's not just about preventing infection, it's also about creating a clear, clean working area. Next, we need to position the needle. Hold the needle at a 30 to 45 degree angle to the skin. Aim it towards the suprasternal notch. This is the area where the clavicle and the first rib meet. Navigating this angle correctly ensures we're on the right track to the central vein. Now comes the moment of truth. Inserting the needle. Use a swift, confident motion to insert the needle through the skin and into the subclavian vein. You'll feel a slight give as the needle enters the vein, a crucial sign that you've hit the right spot. Once the needle is in the vein, our next step is threading the guide wire. This is a delicate process. The guide wire must go in smoothly without resistance. If you encounter resistance, don't force it. Pull back and reassess. After the guide wire is successfully threaded, we need to make a small incision in the skin to allow the catheter to pass. This is called the nick. The nick should be just large enough for the catheter to pass, but not so large that it causes unnecessary trauma to the patient. Now we're ready to thread the catheter over the guide wire and into the subclavian vein. This should be a smooth, almost effortless process. If you encounter resistance, do not force the catheter. It may mean that the guide wire is not in the correct position. Finally, once the catheter is in place, we remove the guide wire. It's important to do this slowly and carefully. We don't want to dislodge the catheter or cause any unnecessary trauma. And there you have it, a subclavian central line placement without ultrasound. It's a procedure that requires precision, patience, and practice, but with time and experience, it becomes second nature. Remember, this procedure carries its own set of risks, including pneumothorax, arterial puncture, and infection. Always take the necessary precautions and communicate with your patient throughout the procedure. While challenging, placing a subclavian central line without ultrasound is a vital skill for healthcare professionals. Adding ultrasound guidance to the mix changes the procedure slightly. Let's delve into how ultrasound can bring about a significant shift in the approach to subclavian central line placement. Ultrasound guidance starts with the application of a sterile ultrasound probe cover. The probe is then placed in the infraclavicular fossa, allowing the operator to visualize the subclavian vein coursing beneath the clavicle. The depth and size of the vein are measured, and the skin is marked for needle insertion. This initial visualization provides a roadmap for the procedure and can help to avoid complications. The next step is to prepare the patient's skin with antiseptic and apply sterile drapes. The operator, equipped with sterile gloves, gown and mask, then anesthetizes the skin and subcutaneous tissues with a local anesthetic. The anesthetic is applied at the marked insertion point and along the expected path of the needle. Now, we move on to the needle insertion. The operator holds the ultrasound probe in one hand and the needle in the other. The needle is inserted at an angle of 30 to 45 degrees to the skin, aiming towards the sternal notch. The operator watches the ultrasound screen to guide the needle towards the vein. Once the needle tip is visible in the vein on the ultrasound, the operator can advance the needle slightly further to ensure it is well within the vein. It's essential to remember that the operator should always visualize the needle tip before advancing it. The needle is then stabilized, and the syringe is removed. The operator introduces the guide wire through the needle and into the vein. The progression of the guide wire is observed on the ultrasound screen to confirm that it is moving into the vein and not into other tissues. Following this, the needle is removed, leaving the guide wire in place. A small incision is made at the skin entry point to facilitate the passage of the dilator and catheter. The operator then slides the dilator over the guide wire to dilate the path to the vein. Once the path is dilated, the catheter can be threaded over the guide wire and into the vein. The catheter's progress is again monitored on the ultrasound screen to ensure it is entering the vein correctly. The guide wire is then removed, leaving the catheter in place. The catheter is then secured to the skin, and a sterile dressing is applied. A final ultrasound scan confirms the catheter's correct position in the vein and checks for any complications. In conclusion, the use of ultrasound guidance in subclavian central line placement can increase the success rate of the procedure. It allows for real-time visualization of the needle, guide wire, and catheter, helping to ensure correct placement and reduce the risk of complications. Ultrasound guidance can significantly improve the safety and success of subclavian central line placement. With practice and understanding, it can be a game changer in patient care. A quick review of key points and cautions is always beneficial. So, let's take a moment to highlight the main takeaways from our discussion on subclavian central lines. From the selection of the right equipment to the patient's positioning, every step plays a crucial role in successful line placement. It's essential to choose the appropriate side for the procedure, often considering factors such as patient comfort, existing medical conditions, and the healthcare professional's skill level. Indications for this procedure are varied, including the need for long-term intravenous medications, hemodialysis, or total parenteral nutrition. However, like any medical procedure, subclavian central lines come with their risks. Infection, pneumothorax, and even arterial puncture are some of the potential complications, emphasizing the need for careful execution and ongoing vigilance. When it comes to the actual procedure, we've covered two main methods, with and without ultrasound guidance. Each has its merits and challenges. The traditional method, without ultrasound, requires a sound understanding of anatomy and a keen sense of touch. On the other hand, the ultrasound-guided method, although more technologically reliant, can offer real-time visualization, potentially increasing success rates and reducing complications. However, no matter the method, caution is your best friend. Always ensure the needle is advanced parallel to the floor in a direction towards the suprasternal notch. And remember, never reintroduce the needle into the catheter once the guide wire has been passed. And speaking of guide wires, always handle them with care. They are flexible and can easily kink or become entangled. If resistance is felt during guide wire insertion, do not force it. Instead, withdraw it and assess the situation before proceeding. Lastly, always verify the correct placement of the central line with a chest X-ray. This is a critical step to confirm success and rule out complications. Remember, knowledge, practice, and caution are key to mastering subclavian central line placement. Practice makes perfect, and with these key points in mind, you're well on your way to becoming proficient in this essential procedure. Lastly, we will discuss how to straighten out the guide wire. This is a crucial step that can often be overlooked, but it's the key to a successful subclavian central line placement. When you have the guide wire in hand, it might appear bent or curved. This is perfectly normal. However, for effective placement, we need it as straight as possible. To straighten it out, simply run your fingers along the length of the wire, applying gentle pressure as you do so. Make sure you do this from the tip to the end. Why is this important, you might ask? A straight guide wire ensures that it can be inserted smoothly and accurately into the vein. It minimizes the risk of complications such as vein perforation and misplacement. Furthermore, it allows for the secure placement of the catheter over the guide wire. This is essential as it prevents the guide wire from slipping out during the procedure. Mastering this final step ensures a smooth and successful subclavian central line placement.